Hello and welcome. You're watching Don Bosco Media Network. This is Abigail bringing to the news and events in Meghalaya. Here are the headlines for today. Meghalaya Health Minister inaugurate Corona Care Centre at St. George School, Nongminsong. The Station of Don Bosco collaborates with the state government in fight against COVID-19, and volunteers of Lightenkra lent a helping hand to the police department against violators. And now the news in detail. The Minister of Health and Welfare Department, Mr. A.L. Hegg, along with the Director of Health Services, Dr. Amanwar, on Saturday, launched the Corona Care Centre at St. George School, Nongminsong, to cater to the COVID-19 patients in and around that area. This centre at present will cater to male patients who show mild symptoms, whereas for the females, the matter will be looked upon at the earliest, said the Minister.
Also, if you see that Balika school, if you see the Gurudwara, many other places also we had started the female. We are going to have more Corona Care Center like this in this surrounding area only. I'd like to thank the administrations, DC, I'd like to thank the NHM for whole teams of the health department. They are working very day and night to ensure that this Corona Care Center in Nongminsong be ready. So thanks to the St. George School principal for providing us the space and also providing so many things from the principal of the St. George School. So this will be 50 beds. That is also only for the male. And this is not only meant for Nongminsong. Anybody who are there from anywhere from Puntarongkra area, maybe from Mopat or from Puntarba or anywhere from this area only, if they are infected with positive, if they don't have a space at home for the male members, it can be accommodated here only.
Like cough, fever, or body ache or anything, then we'll be giving them like just symptomatic treatment like paracetamol, cough syrup, vitamins, all those will be given, and monitoring will be done around the clock. And in case the oxygen level in the body falls, that is SpO2 falls, then only we may have to start oxygen. We have oxygen concentrators also kept here, so oxygen will be given to these patients also. So in case we need to refer them, if we cannot maintain the saturation, then we'll have to arrange a referral to other higher centers.
Don Bosco Youth Centre, under the management of the members of the Station of Don Bosco, collaborates with the state government in fight against the coronavirus by launching a Corona Care Centre which will shelter 40 patients who are grappling with the disease. Today, the 29 May 2021, the Deputy Commissioner, Ms. Isawanda Lalu, Dr. A. Lingdor, Additional Medical Health Officer, along with the Magistrate, Ms. Veronica Lingdor, inspected the centre in the presence of Father James Thurnyang, Provincial Economer, Father Michael Makri, Director of Don Bosco Youth Centre, and Father Genesis Wanyang, in charge of the social development works of the Station, Shillong Province.
Ningidon ka headquarter jungi hapo Maulai Matthias Institute kabangi pet ya Kamisaram Tripura Meghalaya Silchar Barak Bali te nadu mencem senama badon kene ka lockdown badon kene corona nilale bun ki kam tam hakaba lejarap ajing erap kum kini ki dry ration rice pat kiwi pat kum ke province ngila pen la pen reach out la kumba lailak sang ko ajar ngut ki briu parok province tem tau snambat haba kawan biang kene ka second wave iklam poi perkat yo I kene ki jing jong ki briu kam tamane Shillong ke jing Ustad jong uleu yang jingpang de kawan kata kecing semua nangi ikwa ban lei enak benta ki beri jungi kamtam itu kiba tuna haka yo kakwat kiba melak ban yo jing sumar tengile perkat ban ngila jid ya kene ka youth center tokan longkum ka Corona Care Center te ban lei ya kene ru inam la ban lei tangmangi tengila thok ka sha ki bor sarkar sikna priya DC pan makiru kila ayengi kene galat kila ayda kesiti berkawan pedu perkila kemen ya kene ka kam ke bangiru ya persang pada kilang kam tam yele persa yang dipang
category B la kira mild symptoms baka basang tanah chu bah kini ke center kini ke bakan nong kenya father makri kam tam le kila tres to mentenya wat ikinasis ro bakina sa hangne ke long station hangne bakana ka kamram jangini ke nurses kam tam le long ba ada kidon symptoms mild symptoms kini ke nurses ke nyo ban monitor ki aur pusau kanta bar undon doctor bade pat in charge ya kini ke centers rungi health facilities Uban long attached to this. Uban I consultation can advise what nadong kambro ula man visit iki. But hagalor kata kin kandang kajing trail lang kaba lada kini ki belong symptomatic ki kam sitong. Hangilaban but man ra no ki sa ki hospital ki berani ki bal sumar ya ki category C and D. Then that way kalong kata ka response kalong prompt, kalong fast, kalong swift. Hakabanginum Paislam than ki hospital kum ni iman ta bon ki brio kat kin Pais hospital amla man le issue. Te da ka bangibu ha kin centers ka jaka kin Shillong hayang ni la don pa ka monitoring system the ki nurses ki belong professionals and then ki ban means a trained ha ka ba ar kalong doctor undon uban sa yarap iki uban I advise uban consult but ban immediately screening ni cases yo kinong kampadeban kap shift no sa ki hospitals. Koi kamera ko hall ko beri ka stay ka indoor stadium jaki ka badminton court mo man siya ka ba itanmat ha ka belong well ventilated ka ba ka biang ka kani ka sni ka shy ka jaka por ka view ka ambience kalong so soothing kam tamling isu tho ikini ki beri ki bayo ikani jing shitom medei e ka kata e ka tang e ka met ka phan ne ka kata ro jing ka jing per kha kala dangi dong kum kini ki center kanyarap sibon e ya kini ki ong bagi di pang hindi ki bayi yo no kyang sing pang bakin pendep ya kata isolation period of 10 days hai ta I atmosphere I belong conducive ya ka jing kha jongke.
After a complaint registered against some people loitering around the city violating the Pandemic Act, the volunteers of Limekra came forward to lend a helping hand to the police department by driving off the violators. Speaking to the media, one of the volunteers spoke on why they took matters into their own hand by walking in and around the locality to monitor and prevent these people, for there are many who are reluctant to follow the orders of lockdown, which was enforced by the government to contain the spread of the COVID-19 virus.
Nagaliang jungi samla ni ko hiban long yu kan long discipline hi nangi national ni nami we na lagi ni pengo raki long ni pana ka dimbet to pada ki ko banwan rat ni kin wan rat mentai ko di hadan hi banang rat ini maka senang ru ni pan di rat man ka dong ni bu na samla kin dapat jam kalau saya am ko ba ni kalau ulang na kan auto rat le ayo ngapli tang sini kong ba ni palai nah kita ini gila bani like ni kita bawa sim dawai nah rukan na hospital gila bani na baru dari sekali ke barat pas di situ ndai mangi sekolah itu ada ngiling ipan ka ID proof sih macam tanya ya police department ga kala trace to ni ba kamla pakai ba yu kedan kam tiarap ni senong nak kamla na dong ni kedan kam ni miru sama si kimla ra marun handle kan supaya kita play kayau tidak dengan itu police department kimla kasak sang mau kibri consume social distance tapi mentangi hak yang ni nak khmat ni sama nasional infra dan patulun berak we yang ni mengi we sama ni.
So viewers, that is all we have for you today. Till we meet again, thank you for joining us.